Awesome. Welcome everyone to episode 19 of the Exoskeletons and Wearable Robotics podcast. Today we have a special guest, Jason Gillette. And as always, it's me, Bobby Mario of Exoskeleton Report and Dr. Tom Sugar, Wearable Robotics Association. Before we get started with what is for sure going to be a wonderful episode on the applications and task selection of occupational exoskeletons, special word to our Patreon sponsors, as we have a new one as of this recording. Special thanks to Digity for supporting the Exoskeleton Report and the efforts to popularize this technology. And as always, thanks to our VIP supporters, Volker Bartenbach, Rita Vasquez-Torres, and our corporate level sponsors, Humotech, Oxivo, HeroWare, who are now also joined by Digity. Hi, Jason. Thank you so much for taking the time to be with us. For everyone, Jason Gillette is a professor at Iowa State University. He has presented at least 6 or 7 times now at the WRA conference, both in the US and in Europe. He is one of the first people to write a paper if exoskeletons are personal protective equipment or tools. He has a ton of real-world field data and evaluations of exoskeletons, and he's a specialist and an expert in really understanding where and when to use exoskeletons and get some quantifiable data on their usefulness. This is a topic that continues to be relevant to this day, task selection of exoskeletons. So I hope that we can get into it. Hi, guys. How's everyone doing?
Doing great. Thank you for this opportunity.
Yes. So I don't, maybe you could talk to us, maybe first off, Professor Gillette, how did you kind of get started in the exoskeletons and, this technology? I know you've been an ergonomist and teach biomechanics, but, what got you started in exoskeletons?
Yeah, with exoskeletons, the first really my introduction to it might have been 2015 or so. And it was through Terry Butler, who had worked at Vermeer as their safety VP for a long time. And he was retiring and going into consulting. But right during that transition, they were concerned about shoulder injuries in their painters and their welders. And there was this emerging exoskeletons. And he was interested and contacted me and said, really, how can we assess these exoskeletons? And at Vermeer, they had welding simulator and a painting simulator. And I said, that's where you start. Have them work with and without the exoskeleton, look at performance, and look at fatigue. And that's where it all started. I was like, well, you don't need a biomechanist. This is very neat. I got to try it on. I was coming off shoulder surgery. And so I was like, oh, this has some potential. And as professors, we're always kind of, look with a critical eye. And I was like, okay, do some initial testing. You don't really need me to do that. See if performance is affected, if fatigue is affected on the simulators, then we can talk about doing some further tests.
Wow. Yeah, so you got started with the welding simulators quite early, because I know ExoWorkathlon now has that as one of their parkour.
Yeah, I didn't realize you had started in the welding. I knew you had thought about painting and you had looked at fatigue and you had looked at quality. So maybe we could talk about a little bit of some of the work you were thinking about and how you were studying, the exos, just to give our audience some ideas on, what are some of the things you could look at and study with an exoskeleton. Because I know you've done quite a bit of work. So you could do, studies at the company, welding simulators. You could also do real world testing, but you've also done lab testing, and you've done the gamut of just real testing, but also EMG. But maybe just start walking us through maybe some of the things people could do straight off, like easy tests, and then some of the really more sophisticated work you've been doing.
Right. So, after those initial welding simulator and painting simulators, What they really saw was the performance was similar with and without the shoulder exoskeleton, but they were able to maintain their performance for longer. So this looked really promising. But then the question was, okay, well, we hope our workers just don't keep doing the same thing till they drop. And that's really what these simulators did. It was until they said, I'm too tired to continue, or their performance dropped below their threshold. They had strict threshold performances. So then the idea came up, and it was asked to, we like these performance measures. They're great, but we want to know what's occurring underneath the skin, is how it was brought to me. And I was like, well, a real challenge when we think about biomechanics and things like that is, what is the body doing and what is the exoskeleton doing? And I was like, that's tough with our standard, just some of our standard ergonomic analyses with our standard things we do in a biomechanics lab. How can we separate out the two? And so I said, well, EMG is a way to do that. And now we've really taken a step in that technology. It's all wireless. And that would be one way to look at very specific targeted muscles, surrounding muscles, and say, well, we could have people do their job tasks while wearing the exoskeleton without, and we'll just compare the two. And I said, we can do simulations in the lab, set up the postures, the tools, try to make it as close as possible. And that sounds like the nice controlled way to do it. And they said, well, we'd like to do it out in the field. And I'm like, well, I'm not sure. I'm not sure how well that's going to work. We've got portable EMG, but we don't really have a way that we tried out ways to track motion, things like that. But we can go out there, do the with and without EMG and see if that works. And that took us to John Deere, several locations. And they had identified overhead work, and this was assemblers, it was painters, it was welders, it was parts hangers, parts coming on and off the assembly line. And they were great. They worked with us. There was volunteers. They were great too. We just had them do the regular job, and we'd find where they could be doing so long, and then they would be doing the same thing again. That was really the key, that you're doing the same job without the exoskeleton, and you're measuring, apples to apples there. And it actually worked. And we got good data and things like that. And then the next question that I had there was, okay, we have this all the time in science and biomechanics. You go and you do your statistics, and you might find a significant change, or you might not find any change, but who cares? It was like, is it a meaningful change? We're always trying to answer that question, and it's not an easy question. And that's where I got into looking at fatigue curves, threshold limit values for fatigue, and said, okay, where we would see the potential for the best fit of the exoskeletons is we do the analysis of the job. We see it's fatiguing for our targeted shoulder muscles, and fatiguing without the exoskeleton, we put the exoskeleton in, and we have enough decrease in that shoulder muscle activation that takes you from fatiguing to non-fatiguing. I said, there you've got something. There, then you're to the point where, okay, you've identified this type of job. Here's where you can do further trials and get that longer term data. So I think that was a good start. And then we started what we saw in the field. We started collecting the data in the lab and saying, okay, we're going to try to simulate these things. And in the lab, we can also get motion data. So John Deere was a great start for that. We saw some jobs that were matching. We saw some jobs that weren't. And the other thing that we started, it was just the very beginning, I got appreciation. We started doing simple surveys. What did the workers think of the exoskeleton? And how would you improve the exoskeleton? And that, I think, has become more and more important. The surveys have got a little bit, they have gotten longer, but that feedback that you can share, if possible, with the exoskeleton producers, I think is really, really important as they're designing their next generation. So from that initial start with John Deere, did testing at Toyota, And we did several rounds of that. And these were a different type of jobs. Now it was all assembly, pretty much all overhead assembly. So more repetitive jobs. The cars are coming by every minute. And so now we went there and we tested different jobs. And then we started doing things like measuring part weights, tool weights. And we said, okay, these jobs, we got your different classifications. You would get kind of the optimal, where you go from fatiguing to non-fatiguing. Good. You get some jobs that were fatiguing to fatiguing. And you said, well, the exoskeleton might be good, but there's probably more to be done. And then you get ones that were no change. And they said, well, I don't really see the exoskeleton doing anything. And then you got ones that are below fatigue. You're like, okay, if there's problems here, it may not be the shoulder fatigue problem. There may be something else to look at here. Maybe the exoskeleton's still helpful, but at least what we're looking at, it doesn't appear that is a match. And from that, so we had done, if I'm remembering right, about 22 different jobs there. They were all different, similar but different as it goes. And Toyota has mapped those out second by second, what their postures were, what their tools were. And they said, okay, can we use a type of your data to make predictions? I said, okay, well, if we've got tool weight and we've got posture, we've got EMG data, we could start to make predictive models. And they said, oh, well, we've got if you could develop a simple model, we've got it mapped out for these different jobs in Excel files. And I said, oh, sure, send that to me. And, I was figuring, it'd be another 30 jobs or something. And there were hundreds. So you're like, oh, wow, this is beyond what you could do that field. I mean, nobody could do that many jobs, but there are a lot of similarities. And that's where we got into the idea of, can we make these predictive models to say these jobs are a good fit? These are the ones that are best candidates for trialing exoskeletons. And of course, Toyota did much more work on that. They made it PPN on some of their lines, and then they tracked injuries over several years. And that's kind of that nice cycle that takes years to do that, where it really all comes together. So that was kind of the early steps. And of course, as you go through all those steps, now you have more questions.
Oh, that's fascinating. There's a couple points I think I wanted to get out to the audience. One is what I heard loud and clear, but I want to say it again, and maybe you could help say it again. There's some jobs where the exosskeleton's really going to help, right? And then there's some jobs that aren't going to help. And so maybe I think that's where we need to talk about as an industry, right? Get some of those really good wins. And so maybe could you just talk about that for a little bit? Like, why do you think, what are some of those jobs like, if you're a company, I don't know, you're another car company, or you're putting together washing machines, you're putting together motorcycles, you're doing some things. What are some of those, like, could you give us a couple points of like these tasks or these jobs make a lot of sense for exoskeletons?
Yeah, and that really gets into the prediction models. And, it's going to depend on your exoskeleton design and the settings on the exoskeleton. And of course, you always want that properly fit. We found that was really important. But there were some commonalities, no matter whether we're talking about manufacturing or construction or other jobs. And it was, okay, if we've got kind of that standard type of exoskeleton that engages when your arms are at a certain angle. Say it starts engaging at, say, 60 degrees of flexion and engages up to 135. What I was really trying to map out was, what is that sweet spot in terms of posture, tool weight, and also how often are you doing the jobs? So how much repetition, how much exposure is that? And you started to get into that kind of our classic designs were really this arm straight out 90 degrees to about 135. If they were doing a lot of those movements, that really seemed to be a sweet spot of support. It seemed to be more effective when you had some weight in your hands. When it was unweighted, sometimes we were finding that fell below the fatigue line unless it was really repetitious. So we were finding, okay, we have this nice space in, 3 pound, 5 pound, even up to maybe 7 pounds, things like that. At some point it gets too heavy and the exoskeleton is built for taking the edge off, not to make you, Superman or Iron Man or something like that. So it was kind of these intermediate part tool weights, and that was a, significant portion of your job. You were doing that, say, half of your time or more is when you saw the most benefits. And so it was really that combination. You're doing it a lot, and maybe it's repetitive, but that's was, I think the most common is repetitive, but we'd see others of these jobs where they're like installation, like installing water sprinklers. They were doing a variety of things, but number of steps, but they're all adding up to the arms where they could only be lifted so far that their arms were elevated for a good portion of those work shifts. And I think that's really that map. And that's something I'd still like to do, some sort of like color map or something that's red, green, and things like that. We've done different versions where you could look at exoskeleton, you got a job, and you say, oh, this is my postures. This is about the parts and tools you are. Oh, I'm in the green. Or, where the exoskeleton would be good. Or it says, oh, I'm too heavy, or the arms are too low. And I'm looking for something different at that point.
And speaking of color coding, I'm itching to ask you, I believe that you were working on a phone app, if I'm not mistaken.
A fall map?
A phone.
A phone app. Sorry.
So you
totally missed.
Yeah, an iPhone app. Yeah, because I liked, we can go down that road a bit too, where starting to use, artificial intelligence technology to start mapping out tasks, right?
Absolutely. So that was really kind of the next step is how do we go out into these varied situations where maybe the jobs aren't mapped out. And even if the jobs are mapped out and they've got it posture second by second, there was the idea, oh, someone's got to look at this, and maybe they got video tools, maybe not. They've got to take their best, use their expertise, their guess at what the postures are. But then they go and they change the line. They got to start all over and redo that. So this idea of, can we integrate all this data that we're taking and have a tool where you can go out into industry and collect data that is accurate and it's easy and it's usable. And those are tough things to bring together. And so, and I don't know I'm sure there's multiple answers there. We've gone down the sensor road and things like that. And the sensors worked reasonably well, IMU type, when we were there and we were setting it up. But the question with that was, how many companies are going to invest in that? How many are going to have someone who's trained to put these on? So that took us to, okay, what is something that pretty much everyone has access to? And that got to be your cell phone. And with the cell phone, the idea is you videotape the job. And a lot of people are pursuing this. Videotape the job, get accurate motion information. And I think it's important with that too. You're inputting some sort of tool weight or part weight into that, because that also is an important factor. And then, the AI is used to extract the worker's movement. You basically come up with a stick figure or avatar, similar to what we would do in the biomechanics lab. And then once you've got that, you said, oh, we've got this other data where we've got a similar situation. We can map out postures, tool weights, and repetitions and say, okay, we saw this level of muscle fatigue. And, if we're targeting the shoulder, we would say, okay, this was a combination where we saw benefits from fatigue, different non-fatigue in the shoulder, and always combined with this, but we didn't see negative effects in the back. We're always looking at surrounding muscles too. The last thing I want to do is solve a shoulder problem and create a back problem. And so we spent time in the National Safety Council gave us some pilot money to work on this. was, okay, develop this app where you can collect it with your phone, upload it to a website. It would do the calculations, and then it would give you this idea, is it a fatiguing job? Is it not? And then also, if you're using a shoulder exoskeleton, we match it with the without data. Would we expect to see an improvement? So the idea was this could be something for just assessing jobs. And on top of that could be the without exoskeleton recommendation. So we spent work on that, and we went out and we collected quite a bit of data, 20 some workers. Again, this was at construction of a large data warehouse. So we're trying to get overhead jobs, but a real variety of jobs. And at the same time, we were in the lab, and we said, okay, well, in the lab's where we can do our validation and have EMG going, have the camera phones going, have our 12 cameras, and then say, well, how accurate is the movement? How accurate is our prediction muscle fatigue? So what does the app say versus what does the EMG say? And ultimately, it's this idea of fatiguing, non-fatiguing. Does the app give that same recommendation as when you use these other independent systems? So that's something we worked on for a year, and we continue to work on. And I think the question with an app too is we were real, in the lab situation, we're real happy. And this surprised me too. But we did difficult things. We had them turn. We did them have seated assembly, standing assembly, turn all around, all these different postures. We tried to make it really hard. And it tracked well. And it did 3 dimensions. And we were like, okay, that's good. We're going to go out in the field and make it really hard. We're going to put them in scissor lifts. We're going to have multiple people around and things like that. And we succeeded in making it hard. The AI at times would go, I don't know what to do. And it would jump to someone else and things like that. And of course, there's multiple companies working on that. So I think there is a real future in that. And it's really, is this going to be, a standalone app? Is it going to be things that are added on to existing ergonomic suites? I think that's the idea of sustainability and how this gets into people's hands is still a question to be answered.
Yeah, that's important.
Right.
I remember I like what you were talking about. I'm going back to still, again, this idea of fatigue or not fatigue, just so we can kind of finish this part off. I liked what you talked about at some of the initial WearA conferences where you said, we know there's jobs that are very tough ergonomically and they're fatiguing people and there's troublesome. So that's where you want to apply the exoskeletons first. I think Terry talked a lot about that. You talked a lot about that too. So maybe you could just talk, just to finish off a little bit about, we're not going to get into all the math, but you had these TLV, if I remember, TLV curves, and you would say, we know here's some tasks that are truly fatiguing people. And then here's where, an exoskeleton could work. So maybe just to kind of maybe finish off on, kind of come back around and finish there with the shoulders.
Yeah. So in terms of, and it was again, this idea of there's a change, but do we care?
Yeah.
And so the idea was, how can we take this EMG data, which is scaled? We do maximum voluntary contractions. So it's scaled to a person's capability. How can we go and say good versus bad? And that's where we found, and this is based on really a long history of muscle physiology work, is the ACGIH threshold limit values for upper limb localized muscle fatigue. And it's just this non-linear curve there that's based on your percent maximum voluntary contraction, or you could think of it as percent capability in duty cycle. And so it makes a lot of intuitive sense that the more often that you're doing a task, the lower your threshold is going to be for fatigue. So for example, one of those key points on the curve is if you're working at 40% of your capacity and just doing that one job, it's 40% of your capacity. If you're doing that more than 10% of your 2-hour shift, you're going to fatigue. And then you go down the curve, and you say, oh, well, what if somebody's doing it half the time? Then you're down in that, okay, now the threshold's much lower. It's say 16, 17% of your capacity. So we're saying, okay, now we're getting this idea of intensity and exposure. And those two together, I think, are very, very important. And then we started looking at in terms of mapping, okay, we've got these particular positions and we know that certainly if you're up at 135 and you're holding the 7-pound tool, that's rough. But we've got others that, a lighter tool, your arm is lower, say you're at 90. But we know people are in multiple postures during a time period. And that's where we got into this idea, because originally the idea was you look at each posture. Is any one posture fatiguing? And the real problem with that, there's some value to that. That would allow you to flag postures. But then we were finding, no, these are these jobs that have this whole variety, 5 different postures that are all below the threshold limit value. But this job checks out as really hard overall. So then it was like, oh, we've got to add all those exposures together and basically do a weighted average of all those postures. And you'd say, no one individual posture triggered the fatigue threshold, but this combination, you're above. And I think that was a big step for us to have that realization. I think it made common sense, and it really matched up with what the ergonomists were saying and what the workers were saying in terms of job difficulty. And that also allowed us to get into this idea now of prediction, is that maybe you're not eliminating just this one posture, but you're reducing several of them. Or, maybe you're giving more assist to the tool weight, things like that. Maybe they're getting more break. And the idea that all of those could fit into a threshold limit for fatigue.
Okay, we'll end on that, and then we'll start maybe talking about like lower back and some other topics. But to end on this topic, you at one point you made I know you guys do this, you made a white paper and we put it up on the WearRA site. But now, just so for people if the audience wants to look at your work, obviously they can look at conference papers and journal papers, but you're also building the test standards, right? So you're working with, is that true? That I think you took this body of work and put it together to a test standard. Is that true?
Yes, and that's
I know
a
it's
long time. It's a long time in coming, and that's what the ASTM. And we've had a test fixture that we can set up different postures, and the idea of how do we best test, say, a shoulder exoskeleton in this case. And we have now gone through numerous versions of that, and that's kind of some of the delay in the standard is my own perfectionism. That, and so the idea there is what are our most common postures, and we started with Toyota had recommendations for that, but then we also found out all of ours are ahead, but we also see shoulder abduction in there. So the idea with the test method is how can we have a structure that's pretty simple that you can, just put sliders and things like that, set up these postures for someone, have them repeat with the exoskeleton, go to these postures with no tool, let's say a 3, 5, 7-pound tool, and then put an exoskeleton, look at what the changes are in terms of EMG, and then that's where you apply the TLV and say, okay, again, this idea of sweet spot. These are fatiguing combinations of positions and tool weights, and this is where the exoskeleton makes a difference. And the other thing that I haven't mentioned, but is really interesting and that we've been working on correlating, is we're always asking perceived exertion now, and just seeing how well that lines up with the EMG. And it actually lines up very well. I mean, the sweet spot for perceived exertion and the sweet spot for EMG are very, very similar. And that's encouraging. But you'll see kind of at the edges is where it differs. If a tool is really light or it's the lowest arm angles. You may see some benefit from the EMG, but when you talk with your participants or workers, they say, this didn't really make a difference. And so that's important to know. But you get at some of these extremes too, and this is what's been surprising. So at times you would test just right overhead, and the EMG wouldn't show anything, but the workers would say, oh, this is really horrible, as you can imagine. And they say, I feel benefit from the exoskeleton here. So I do think not only having that quantitative measure, but that subjective measure, I think that, and then of course usability, when those all line up, you've really got something, because I think you've got that evidence that's really doing something. But I think you've got a better chance at adoption if it's comfortable and it fits.
Yeah. Let's jump before we go to another topic. Let's still jump again on this adoption, which is, we know, because you've known it, you've seen it, you saw it at Toyota and John Deere and other places. You talked about that. What's the perceived benefit? What's the usability? Does it fit well? And we have EMG data and TLV curves to prove that it's helping. So we've got all of that, and we don't have as much adoption, I think, as we all would have wanted. What do you think about that? Why do you think there's maybe a little bit less adoption than we all had hoped for?
Yeah, and I think a lot of that is, and this is definitely one of the shortcomings of testing, is how much time have the workers been able to adapt? Because it takes some getting used to trust the exoskeleton and to not fight it and say, oh, this is helping out, I'm just going to do my regular motion. But this idea of taking the edge off of that. And this is this idea of why the adoption isn't as much as we think. And that's where I'm really digging into the construction data we had. Because what we saw with that is, you looked at the overall data, and this was with the shoulder exoskeleton. It showed really nice EMG. I mean, your shoulder flexors were down. Even the back was down. Your upper trap was down. We see the systematic lowering of muscle activity. So we say, okay, it's doing something overall. It's not every job, but overall, those are good. But then you'd start looking at what was satisfaction. So overall satisfaction, and it would be split. Say a third would say, this was wonderful. A third would say, I'm kind of neutral to it, undecided. And the third would say, this is not for me. And you'd say, okay, well, this is definitely more pessimistic. And so part of what I've started doing is look at, okay, what does this correlate with? Does it correlate with anything? Does it correlate with perceived exertion? Does it correlate with the EMG data? And just within the subjective, what we found in construction, it lined up really well with their own rating of job performance. So, okay, does it help me in the job? Because we have them rate their job performance without the exoskeleton. So they've got to perceive that, I think if I'm going to do this extra, that it's not hurting my job performance at all. And the other one of them that was very highly correlated, again, this early analysis, was body conformation. They wanted it to that fit and not to be hanging out from their body at all. They said that was very, very important to them. So kind of the idea again that when I'm not doing the overhead work, I don't want to know that it's me and things like that. So that's always tricky, to make something that's going to give you substantial help and that's going to disappear. So I think that's part of it. And some interesting things. So you take this data in the lab and they just consistently say, oh, I feel the muscle benefits of it, all that. I think it helps my job performance. So you get this really optimistic. But you take this just from our college population and you ask them a question like, would you be willing to wear this around coworkers? And all of a sudden they say, I'm not so sure. But you go out with the workers And this speaks to the work environment there. And they say, no, I'm fine wearing this around my coworkers. And another thing they rate really high is they say, I see this technology is beneficial. I see this for so-and-so who works overhead all the day. I think this would be perfect for him, but maybe not for me. So again, it's that gap, and it's got to match the job, and they've got to see that distinct benefit in how they feel and not interfere with the job.
So I want to jump in on that idea that matching with the job or matching with the task. For 9 years now running Exoskeleton or Report, that is a topic that I keep seeing over and over again, where even experts sometimes admit that they had the wrong exoskeleton for a difficult job. And today, Tom and I were in a meeting earlier this morning. We heard exactly the same thing, where it was just the wrong exoskeleton for the job. And now the employees have a negative initial impression. So if we're not ready to roll out like AI phone apps that help manufacturing engineers or small family companies make that decision, what are some words of wisdom from you on how to do exoskeleton task matching?
Yeah, I think that is a really, really good question. And I do think some of our standard ergonomic tools are not a bad place to start. And I think they've really got to talk to the workers, because places where we've seen that they really jump on it, it takes that initial person or couple people who say, and oftentimes these are, very fit, respected workers and things like that. And they say, this helps me. This is going to help protect my body. So I do think it's going out there. And in an example, we were doing this data collection at the database warehouse, huge warehouses, very big construction type of project. And so you saw a lot of jobs that were identified as potential for exoskeleton, and you're in scissor lifts, you're going overhead, and you say, yeah, I see that this definitely has potential. But then there were some jobs that they say, oh, these are ones that we have some injury concerns about potentially. And you went and it was lifting parts or spools of wire from forklift to different shelves. And you're like, we can try this out here, but this looks like something that's as much, if not more, of a back problem than a shoulder problem. And so, and that's actually something we're doing right now is we're going back and we're saying, when you're doing a variety of heights, are you going to find that shoulder exoskeleton is beneficial over all those? Or is it going to be something like a back exoskeleton? Because obviously people don't, if they're going to be doing both of the same, they don't want to be switching from one exoskeleton to another, unless there's some sort of a combination, back and shoulder out there. So I do think it really takes, and we've classically relied heavily on the safety professionals to go out and say, these are the jobs that are, but I do think it takes maybe that second opinion to go out there and to say, okay, this is what I see from these jobs. And I think it takes talking to the workers too. Is this one that you feel that's stressful on your shoulders or back? Do they perceive it as a problem? So I don't know if that's a good answer. It's a difficult question.
Yeah, I think it's an excellent answer, because what I'm hearing is talk to you people, trust their opinion, get a second opinion, talk to a consultant, talk to an integrator. I don't think that an answer gets any better than this.
Right. That's what I had heard too. I was going to say, what I'm hearing loud and clearly is, an exoskeleton is something that gets fitted on the person. It's got to be comfortable. It's got to work right. It's not something you can just take out of the box and put it on. So this idea of ergonomists, integrators, and Bobby's been working with, doing some things in that area. I think it's quite important. Maybe we should switch to another topic, which is, so I know you're an expert in shoulders. And so for people who are interested in shoulder exoskeletons and things like that, but you said you've now started looking at lower back, and also instead of just the car industry, you've started looking at construction and maybe some other places. So maybe you could give our audience some of the work you're doing, and maybe what is some of those future things you hope to find out, or future
Okay.
things you're looking at.
So, and that's really, it's all part of what do you go out and observe at these workplaces, and listening to the workers. And when you're asking about overall, what jobs are challenging, what part of the body. And of course, we were seeing not only shoulder, which is what we did a lot, the vast majority of our early work with, but the back kept coming up regularly. And of course, that matches with your injury statistics. If you go out and look at that back, and you have shoulder, very, very common. And so where we got into looking at the back was actually kind of three-pronged. 3 different jobs came out, which was kind of interesting. One was, I mentioned already, with construction, that we were seeing, okay, not only are we having people that are doing wiring and putting up routers and support and things like that, but we had people who were doing staging and kind of logistics type work, getting parts wire ready, and they were doing a lot of bending over. And so that has led to, we said, okay, we saw these other jobs, we're going to go and replicate these jobs in the lab. And that's where I was talking about shelves of different heights. Do we have an exoskeleton that really shows some benefit, or at least doesn't detract when you're working at multiple levels, which we were seeing? And then, shoulder exoskeletons and back exoskeletons. Another area we got interested in the back exoskeletons were when people were doing awkward postures. And these were more static postures. And so we were thinking, classically with back exoskeletons, we think about lifting. But if you have someone that's leaning over, and this was early discussions with Mayo Clinic about surgeons, special surgery, some of those surgeries go 8 hours, and they've got a patient physician there, and they're leaning over doing these things. So it's like, okay, this is not a situation that we've looked at before. Maybe welding, they would hold positions for a long time, but the idea, okay, now we've got to have something that's comfortable, and it's not so much a strength, a lifting type thing. It is protecting against your own body weight. So those were discussions about that with surgeons. And we did a study in our lab that mimicked, we went out and talked with, that maybe not be something you think about, but dental hygienists. And dental hygienists, you're there in your chair. Maybe you're not, you're as comfortable as possible depending on the work you're getting done that day. But they bend over, they cater to you. And if you look at their injuries, you look at it's neck injuries, shoulder injuries, back injuries. And if you blinded it to me, I might have guessed manufacturer. And it was very different reasons, but the parts of the body were very similar. So that was another where we said, maybe a back exoskeleton. We looked at shoulder exoskeleton. We looked at a neck exoskeleton, a prototype there. And as we're going down these lines, we're always looking for problems. It came to us, and in kinesiology, we have a lot of pre-PTs, pre-med students, that there were a lot of injuries in patient hand. And so this is one of our projects that we have a 3-stage project going on. And we finished the first stage, and we said, okay, let's look at several different models, fundamentally different designs of back exoskeletons. Because some of the surveys with healthcare professionals were saying, if you suffered a back injury, some were saying 90%. I was like, oh my gosh, this is horrible. But obviously it's a very common problem. And so we started as basic as you can start. HD student of mine, Maddie, and it was, okay, let's transfer a weight from a wheelchair to a bed. It's common transfer. And we're just going to put 35 pounds because 35 pounds is a NIOSH recommendation. And we're going to put a gait belt on it and we're going to do the transfer, see if we see any reduction in our lower back muscle, make sure we're not seeing negative in the shoulder. We're going to ask people their own perceptions and we're going to look at movements, make sure we're not getting any detrimental type of movements that we're not offsetting with the exoskeletons. And we're going to talk about usability. And so we see some promise from that first study. And what we're currently doing is we have a simulated patient. So now we've got someone acting as the simulated patient, which is fun for our students. But okay, now we don't have just the milk crate. Now some variability in support. We track that to make sure it's consistent. And we're going to do the same transfer. We're going to go wheelchair to bed and bed to wheelchair. And so we're going to say, okay, do we see some benefits? Is back exoskeleton a practical intervention? And so we're well into that. And that is pointed to, now we've talked with the local medical center, and they've said this is definitely a problem. It's not just transfers from wheelchairs to bed. It's sometimes they need to be transferred to the ground. Sometimes they just need to be adjusted in their bed, transferred to when they're using the restroom. And they said, we'd be interested, based on your results, in trialing this. And so that's our next step on the line. As we get our results, now go with the experts, get their opinions on usability. But now when you go into the field, now we've got infection control, all sorts of things like that make it more complex. But I think that's a nice one with the back exoskeletons, where we started with the simple analog of it, went a little bit more complex, and now we'll go out into the field. And then the field will be, relatively acute, but then you start saying, okay, if this is working, if we're seeing benefits, they perceive benefits, they think it's not interfering with their job. That's when you start doing it for the longer term. You say, beginning of the day, end of the day, beginning of the week, end of the week. Now we're going to go several weeks, and you build out from there, and you get their feedback as you go along, make sure things are still fitted. So as a potential application for back exoskeletons, I like that, but I like the general progression in knowledge too.
No, quite
Yeah, and I can confirm my grandmother was a dental assistant, and almost all of her friends who have retired with severe back pain, severe shoulder pain. Some of them have tried cartilage shots and things like that, so they have a better retirement. Some of them have hurt themselves in the process of trying to negate the pain. But I've talked to many of them, and the response that I hear is, our patients are already afraid of us. Imagine if they walked into the office and on top of everything else, now we have an exoskeleton as well.
Yeah, and I think that's a real interesting. And that was one, when we were looking at these different exoskeletons and thinking about it, that was one where the shoulder exoskeleton, we didn't necessarily see that as a practical solution because the patients could see it. And it was getting closer to their space. But maybe something like a neck exoskeleton where they were already wearing lights and things, it integrates right with that. It doesn't necessarily give all that different a look. So I think that's really important. And that's one of the first things when we went over to the local medical center is they're like, well, we've got to see this exoskeleton because it can't scare the patients. And when they heard exoskeleton, they had no idea what it would look like. And so it was comforting when we were able to say, okay, this doesn't look so bad. This looks like, a backpack is on us. And they can't see a lot of the mechanism to it.
I've once talked to a couple dental hygienists as well, and I was thinking something slightly different. Instead of a exoskeleton that's worn, you could have a fixed frame exoskeleton. So there's these gravity compensated arms that can be mounted on chairs, and then you could kind of rest your arms there. So it's not a armrest, solid armrest on your chair, but it's an armrest that can move, let's say, with you, to give the audience an idea. And you still don't see too much take up, even of those types of things as well. So, you know what I mean? Like,
Yeah, and that's
like
interesting. And that could be with the neck too. You have something that hooks on, you hook it on, you take it off, just like when you take off your lights and your microscopes and things like that. But now when I'm at a dentist appointment, I'm stuck looking at the hygienist and saying, "Oh, shoulder's looking good. Oh, neck not looking so good." You take a different look at the world now.
No, I've actually heard that there's some of the dentists, because they're using a vibrating tool, the drills and things. So it's vibrating and things like that. They can get a lot of, arm pain and shoulder pain, because they're also leaning over, drilling, it's obviously you as the patient it's not the greatest thing when you're getting drilled, but there too, like, because these people are high, surgeons, dentists, they're highly trained individuals, right? And so, and dental hygienists as well. And so you want to try to make sure. I think we've had this term, Bobby, once we talked about it, like age gracefully. Like we've talked about this, I think at one of the WearCons once, where it's like, I don't want to retire in pain. I want to retire and enjoy my retirement, type of thing, right? And so, because I think at the time we were talking to this, it was the steel workers union, I think it was, right? And so they were working, and they were saying they were happy to use exoskeletons, because the exoskeletons weren't going to take a job. It wasn't like we're giving you a robot to take away a job. It was give us a tool to reduce the fatigue in your ideas. Let me ask this question. I think I asked you this once, maybe 4 or 5 years ago. Have you started down the road of getting fatigue curves for other, you're an expert at the fatigue curve for the shoulder, and with and without an exo, but have you started to think about fatigue curves, let's say for the neck or the lower back at all?
In terms of, for example, the neck and kind of our surrounding musculature, muscle in general follows very similar fatigue curves. I mean, you got fast twitch versus slow twitch muscles, and that certainly, and you got different force capabilities, but really that general fatigue curve, the shape doesn't differ all that. I think something that's real key, and I've even used it with back muscles, you got to realize that's just the back muscle, and something about the arms is the arms are out here. Now you're bearing the weight, potentially you've got your own body and your tool. When you get to the low back, you're bearing the weight of those arms, your head, and your trunk. So you can't just look at the muscle, you've also got to look at estimations of compression. So that's always kind of what I say. You definitely can look at muscle fatigue in the back, but realize that you could be at risk in the back beyond just muscle fatigue, even though I think that plays a large role.
Okay. Yeah. I mean, for all of us, I think Bobby's heard me say this too, is like, when you started getting into your 50s and then late 50s, all of us, your lower back starts to hurt, right? Because I've seen, I think some of the toughest jobs I think I've seen is you're in a sorting center. So you're in some package sorting center. You can imagine logistics or post office or anything like that. And you're just leaning over sorting things. You're doing that for 8 hours, because that's tough. Because I do know some of the companies like a Toyota, they'll do, you do 2 hours on this task, 2 hours another task, 2 hours another task. So, so some of the companies are really trying to do their best, at helping and making the tasks, ergonomically safe. But some of those tasks, if you're just sorting packages for 8 hours, man, that's just tough.
Yeah. And as an example of this, and this is an artificial example, but a personal example, is when we were working at the data warehouse, we wanted them to be doing the exact same thing with and without the exoskeleton. So they said, well, my job is to take all these part boxes and put them on these variety of shelves. So he said, okay, you do what you would regularly do. They brought in a pallet and she went through all these motions. I said, we worked with her manager and said, we'd like her to do this again. Sometimes we're able to bring in another pallet, but this one I said, well, we'd just like to do the same thing again. So I took all those parts and put them back on the pallet. I could hardly move after doing that several times. So it is just that when you're doing that for a certain amount of time over and over, it really does build up.
Yeah, it sure does.
All right, so we've been over an hour. So any last thoughts so we can close it out?
I think in terms of any last thoughts for me, one thing I would say is I would just encourage the exoskeleton community, and this is including our academic biomechanics nerds out here who are taking all this data, the safety professionals, those that are working at consulting, and the developers, just to really be open and share their data and be honest about their success stories and some of the challenges and what we could learn from it. And I think we've gotten much better at that, but I think there's still much more that we can do. And, the more of that we get out, that's real world testing, rigorous testing, longer term testing, I think we're all going to benefit from it.
Thank you. Yes, I second that.
I second that completely. Any last thoughts on kind of where you see the exoskeleton technology community going, or how, or how do we get more adoption? Because I think that's kind of part of this podcast, is just to really talk to experts and get the word out to more people than just our small community, but get the word out to a lot more groups.
Yeah, somewhere where we could advance. And, I've thought about that. But maybe it's a little bit of this combination of we go out and we got exoskeletons and we find exoskeletons that are, be it a back or shoulder exoskeleton, we're finding some success. I almost wonder if there isn't some simple ways to put, say, some sensors on the exoskeletons. And if there were a good way to be able to document, these workers are doing these movements so many times a day with this exoskeleton, and this is their potential benefit. And a way that we get into privacy and things like that. But I think, kind of that day-to-day evidence of potential benefits and productivity with the exoskeleton, and maybe even there's an easy way for regular feedback from the workers. Do you still like your exoskeleton? Did you think it helped you today? Any problems? Of course, that is coming from kind of the data nerd side of things, that, okay, convincing and evidence that they do work. And if they're not, they're not working, I think that data is important too. And people can overlook that. They said, this seemed like a good idea, but boy, it really didn't pan out. Why? And I think the more data we've got about that can inform the next level of exoskeleton. I don't know if we're going to end up having smart exoskeletons, the hybrids. I don't know. Maybe that's that. But I think it's, again, some of the when you look at some of our success cases, why have they been successful? Well, because the exoskeletons were easy to use. They were a good fit for the job, and the workers thought it helped them. So, that seems to be, if you can bring those all together, you've accomplished something.
Right.
Wow. Wonderful. Well, thank you. Thank you so much for taking the time off your schedule to talk to us, to share your experience. There's not many people on the planet that have as much hands-on knowledge with analyzing the effectiveness of occupational exoskeletons. I believe that you have worked in tunnels, you have worked in construction sites, you've worked now in hospitals, you've worked in warehouses. I'm sure the list goes on and on and on.
Oh yeah, we didn't even talk about working in a tunnel in Alaska. And I don't think many people know that one time I climbed up at least a portion of one of those wind turbines to look at how exoskeletons could be used for maintenance of those. So there's lots of applications, and I think it's been very rewarding to go out and meet the workers that could directly benefit with them. Go out there, experience their jobs, talk directly to them so that you respect what they do. And I think they can be very open to sharing their opinions.
Wow, what a great way to close it off, that this is about the people. This is about the workers, not technology for the sake of technology. It's about making humanity better. And with that, let's close it off. Thank you everyone for listening. We hope that you enjoyed this episode. If you did, please subscribe to our Patreon account. Any help or assistance is both a financial and a moral support as well. Thank you, Dr. Gillette, for your time. Thank you, Dr. Sugar, for being a wonderful co-host. And we'll see you all next time.
Thank you.